and I'd like to welcome you all to the next session, which is Exploring Medicine. So I'm delighted to introduce Jacob Brown, who's Student Recruitment Manager at St George's University of London. Jacob, St George's is a very esteemed old institution that was set up in 1752, so even before my time. So that's something. And St George's has a great heritage in medicine, and it's wonderful that Jacob has joined us today. So St George's is a UK specialist health university and is the only UK university to share its campus with a major teaching hospital, which is St George's University Hospital's NHS Foundation Trust, that I believe is in Tooting, southwest London. I've never actually been there, but my daughter currently lives in Tooting, so I must go and visit. So really excited to hear. It's wonderful to get a university that is so focused on medicine to attend today. We are really, really lucky to have Jacob with us. So we're excited to hear what Jacob's got to tell us about exploring medicine. So over to you, Jacob.
Thanks so much, Pat. It's lovely introduction there. Thank you very much. As you say, it's been around quite a long time, St George's. So before all of us in the room and many of our parents and grandparents, and maybe grandparents even before that. But hopefully you can see my slides on screen. Pat, can I just ask you to just confirm that you can see those for me?
No, Jacob, they aren't showing.
They're not showing at the moment, Jacob, sorry.
Oh, apologies.
There we go.
We see it now? Lovely, thank you. So, there we go, all set up. So thank you very much for joining us today. My name is Jacob Brown and I'm Student Recruitment Manager at St George's. So I am going to be speaking you through our Exploring Medicine presentation today. As part of that, we'll quickly give you an introduction to St George's. We'll look at the course that we have on offer and also the application process. So how some of the work experience and personal statement requirements that we require from you, and all medical schools will require an element of. So St George's on your screen there for you, a variety of different photos. Our students are really immersed in a healthcare setting at St George's, as we do share our site with one of the busiest London hospitals, and that is St George's Hospital. And in the top left-hand corner there, you can actually see a photo of the helipad at the university or at the hospital. And sometimes when you're sat in the university, you can actually hear that landing and taking off, which is quite a cool experience. In the bottom right-hand corner there, you can also see some of those photos from back in our past. Now we have over 250 years experience in health sciences, education, training and research. So although we did start out as a medicine school, we've since broadened the courses we have and we offer at St George's, and we now offer healthcare and science courses if that's of interest to you. In the 1980s, we moved across to our current location in Tooting, which is in southwest London, around 25 to 30 minutes from the London Eye on the tube. And some of you in the room may actually be already familiar with St George's without even knowing it. If you've ever watched 24 Hours in A&E, that is actually filmed at St George's Hospital. So you would have seen some of the site without even realising it. But what's really exciting about St George's is you are walking along the corridors with doctors, health practitioners, other students and patients whilst you're studying at university. I just wanted to quickly show you some of the facilities we've got on offer at the university, including an on-site dissection room and a pathology museum, paramedic simulation suite, and also extensive library, just to name but a few of those. And I mentioned we're based in southwest London in Tooting, and we're very close to Tooting Broadway Tube Station, which is part of the Northern Line. And it really is a great place to be a student with lots of cafes, bars, shops, very diverse and vibrant feel. And in the middle photo there at the bottom, you can see our halls of residence, Horton Halls, which is a slow 15-minute walk from the university, and you could probably do it in about 10 to 12 minutes. Where our first year students will often move into accommodation. We've also got an active students union at the university, and they offer over 100 clubs and societies, And we run events such as band nights, film screenings, dance shows, comedy events, and lots more. So a real great opportunity to complement your studies. So that's a brief look at St George's. I'm now going to take a look at the medicine course we offer. On the bottom there, you can also see the other healthcare and science courses that we offer at St George's. They're worth definitely considering if you think perhaps you might not quite get the grades required for medicine, or you're looking for that fifth choice. Obviously, you can only add medicine for 4 choices on your UCAS application form. So you may consider adding a fifth choice of one of these or another course. So the medicine program we run is a 5-year program, and years 1 and 2 of the undergrad medicine program, you will develop a knowledge of the structure and the function of the body, as well as changes that occur as a result of disease, injury, abnormal development, and aging. So those early years are known as the clinical science years. And students will start a clinical and community-based placements from year 1 at St George's, as well as undertake case-based learning, or CBL, as you might already know it. You also have access to our in-house dissection room in these years too. So in your 3rd year, we then change the emphasis from lecture-based activity to a combination of problem-based learning, or PBL, and student-selected components. So this is why that year is given the name transition year, because it's really about preparing you for a change in learning style. You also start 5-week clinical placement blocks in medicine, surgery, and general practice. You then have the opportunity to intercalate. So this can be done after the 2nd year, but most students will choose to intercalate at this point. And this enables you to receive an additional degree on top of your undergraduate medical degree. And at St George's, we offer a wide variety of intercalated degrees, and you can visit our website if you're interested in a bit more information about that. In your 4th and penultimate year, you rotate through a series of clinical placements, and therefore we name it the penultimate, or P year. And finally, in the 5th and final year, we draw together all of the training that you've gathered and your experience to prepare you for life as a junior doctor. You'll then go on to do your foundation training, which we'll talk a little bit more about in a few slides. So we wanted to give you an example of what a week could look like as a medical student at St George's. So this is a year 1 class schedule, and you can see that our students have access to our in-house dissection room, potentially in the morning of the Monday. You could then undertake a clinical skills session where you learn to take blood pressure, insert a cannula, measure heart rate, and a lot of other necessary skills that you will require. And once a month at St George's, we ask our students to practice communication skills. So we'll actually bring in actors who provide a range of patient experience for you to practice while in that somewhat supportive environment, which obviously this is the skill you will need to develop to be an effective doctor in your career. You'll also undertake case-based learning, where you're given a clinical case to review as a group and come up with a diagnosis. And those sessions usually take around 2 hours. We'll also have lectures which take place throughout the week, and students often benefit from guest speakers coming from the hospital, which really allows them to take time out of their busy day to kind of pop into the university to provide those expertise for us. We try to give all students across the university Wednesday afternoons off, and that gives them time to participate in any non-school related activities, such as maybe sports clubs, student unions, or exploring the London area. Obviously, during the pandemic, a lot of universities have moved towards a more online content for students, but there's still a lot of contact time. And moving forward, we're trying to combine that to the best of the student requirements. And we're speaking to our current students at the moment to see what they've really benefited from that blended learning approach, so we can take that forward moving forward. If you want to find out more about student life, I'd recommend popping to our website, and you can hear more about, you can actually speak directly to our students via UniBuddy there. So speaking to Medicine at St George's, we equip students with essential knowledge, understanding, skills and attitudes required to practice medicine. In the third year, our students undertake problem-based learning, where you're given a clinical problem and use self-directed research to make a diagnosis and suggest the appropriate course of action. So that approach, that learning style, encourages self-motivation and a deeper contextual understanding of the issue. Within our in-house dissection room, you can see our experienced anatomists demonstrate whole body prosection. So that gives you a comprehensive overview of anatomy for all of our students. And within our clinical and communication skills sessions, you develop the core patient-centered communication, clinical and procedural skills essential for life as a doctor. And these are developed and integrated through simulated practice involving diverse and authentic clinical skills scenarios, and then actually using that experience on placement. So what's life after medical school potentially look like? So if you're here taking into consideration you'd graduate from an undergraduate medical program, you'd be awarded an MBBS. You can then go on to undertake foundation training and are awarded an FPCC, or a Foundation Program Certificate of Completion. And on your screen here, we've tried to put some of the estimated salaries that you might look to learn throughout your career. You can note here that the length of time required to complete training can vary. And for a GP, you'd be looking to study for an additional 3 years, where some specializations can take a further 5 to 8 years. You're going to find additional information and advice around medical specialities on the British Medical Association website, and more details about the salaries can be found on the NHS website. So looking at the application process for medicine, it's made up of a number of steps. What you really should be focusing on now is developing your work experience. So undertaking and researching as much as you can, even if it is online from now until your interviews. You may then be required to complete an aptitude test prior to making your application, and that should be taken in the year of your application. At St George's, we look for the UCAT, but some will look at BMAT. I'm sure a lot of you are already aware if you are considering a medicine application, but the deadline for medicine is the 15th of October. And before making your UCAS application, we recommend that you check all entry requirements for the course, and you'll need to complete a personal statement as part of that, as well as an academic reference. So if your application is successful, you can then expect to receive an invite to interview from the university's admissions team. Interviews will usually run from November to March. However, universities do look to complete medicine interviews by January if possible. If your application and interview are successful, you'll then expect to receive an offer from the university via UCAS. And obviously decisions can take some time, so do try to be patient whilst you're waiting for that. If you find that your application is unsuccessful, you might want to consider alternative universities offering medicine places, or looking through the clearing route, which sometimes is available for medicine, and also look at other courses that might be available. So due to the restrictions caused by the pandemic, many universities, including St George's, have relaxed their work experience requirements. On the screen here, I've got the admissions guidelines for 2022 entry. These are currently being updated for 2023, but at the moment, we're requiring applicants to have an understanding of the realities of working as a healthcare professional and to show that they have the necessary skills and attributes for their chosen career. So what's really important to note here is that you need to research what it's like to work as a healthcare professional, but not necessarily actually have to complete it hands-on clinical work experience. So your research into work experience is actually what's really required. If you can secure clinical work, obviously that is fantastic and brilliant. It's really going to help, but it's not the end of the world if you can't. Use those online resources and talk about the work experience that you have, be it in a non-clinical setting, in this light. Don't forget to consider any paid or unpaid work that you've done, or if you're part of a sports team, or perhaps helping your community or your family. And you might actually already have some experiences on this. We have a really great webinar session coming up on next Wednesday, a week today, 30th of March, where we're going to talk about work experience for healthcare courses and how you can apply that best to your application. So pop onto our website if that's something you'd be interested in. We mentioned this earlier, but there are two main tests in the UK that are used for first-time undergraduates applying to medicine, and they're UCAT and BMAT. Each medical school will require one of those tests, and that'll be laid out on their website. At George's, we require the UCAT aptitude test, and on the screen you can see our 2022 overall cutoff score was 2710, and there's a bit more detail around that on the website if you want to see specifically from the background of your application. We require each section to have a minimum grade of 500, apart from the situational judgment, which we don't consider. Our admissions team won't advise the overall cut-off score during the application cycle, i.e. for 2023, but this gives you a ballpoint figure of where you need to be aiming. And as I said, you can see our previous UCAT cut-off scores on our website. Here is an example of the A-level academic entry requirements for our medicine programme. I believe most people attending today are sitting A-levels, and if you're not, hopefully this gives you a rough level of where we're looking. All universities will advise the academic qualifications they require for entry, and it's important to make sure you meet all of the requirements, including the GCSEs, as you don't want to waste an application in some way you won't get in. And each uni will set its own entry criteria, so don't assume everyone's looking for the same grades or the same subjects. So you can see we ask for AAA, including chemistry and biology. We also accept resits of GCSEs if you need to sit one of those this year or next year to hit that standard. If English isn't your first language and you've not sat a GCSE or IGCSE, you need to provide evidence of your English proficiency. So IELTS is an example of a language test that we do accept at St. George's, but there are other certificates that you can complete, and you can see a full list of those on our website. You're able to take 2 attempts to achieve your IELTS qualifications per year, and those test results are valid for 2 years. Just a reminder that if you have completed GCSE or IGCSE English language, then you don't need to provide a current IELTS certificate. On the screen there, obviously, is an example of the IELTS score. Just quickly, your personal statement will form part of your application process. And this is a short essay that allows you to demonstrate a variety of things I'm sure you're aware of. But what we really want to see here is, why are you interested in the course? What's your passion? What your understanding of the course is? And at that point, backing that up with the work experience that you have to support that understanding or the research you've done in work experience. The personal statement should also show the university why you are the right candidate for the course. We'll be reading this before we've ever met you, so you need to really sell yourself and show us why we should potentially offer you an interview. And also just a little reminder that we do use plagiarism software, as all universities will, so make sure you use your own words and don't take anything from the internet or copy out your colleagues. An academic reference is also required when making your UCAS application, which your school or college should help you with. Some universities will also use a contextual admission scheme when looking at candidates, and essentially this means that other factors will be considered when we assess your applications. So for some universities, that might mean that you're given a lower grade offer, perhaps AAB at A-level instead of AAA. To learn more about contextual offers, visit the university's website. And if you head to ours at St. George's, you can see the exact criteria that you'd need to meet to fulfill the contextual admissions. Just on your screen there is some helpful websites that you might want to look into a bit more detail, some free talks and courses that are also available, and podcast recommendations from our current students that might help support you on your application process. And finally, from me, just wanted to leave you there with our email address to send any specific questions in. As I said, we've got webinars which you can find on our website. We're running one this evening on healthcare courses. So if you are considering that 5th option or an alternative to medicine, you might want to pop along to that. And next Wednesday, there's one running about as I mentioned earlier, how you can use work experience to the best of your ability to support your application. You can also pop onto our website to speak to our students via Unibuddy, and our social media tags at the bottom there to get in contact. That's everything from me. I will pass back to Pat.
Hi, Jacob. Right, thank you so much for that. It was absolutely brilliant. And I just wanted to, I've got a couple of questions, but equally, if anybody's got any questions, if they could put it into the Q&A section, that would be awesome. So we've got a few minutes. If anybody's got any questions, please do put them in Q&A. But Jacob, I've got a couple of questions, if that's okay.
Yeah, no problem.
So I was just thinking about how can you show passion for medicine? It's not a trick question. I genuinely don't know how. I think this is very difficult now. How can you show passion for medicine without necessarily having, the clinical work experience that you might normally have in pre-pandemic days?
Yeah, I think it is a challenge, but what we're really looking to see is how are our students reflecting on the experiences they have had. So perhaps that is supporting a family member at home. What have they learned from that experience, and how can they apply that to a healthcare setting? So it could be around the communication that you use and how that actually affects your younger brother or sister's mood. How can we apply that? How can you think about those skills? How would they apply in a clinical setting when you're dealing with patients who perhaps are waiting to be seen for a number of hours? And how have you reflect back on the experiences that you've gained to influence that thinking moving forward? The same applies for teamwork. If you're perhaps in a sports club, relying on other professionals in the sector as a doctor or a GP, you do need that reliance of your other team members. So trying to apply those almost everyday settings, but thinking about it from a clinical perspective, how does that apply in that scenario? There's some really great resources on the website, and I'm sure on many universities' websites around this in a bit more detail, how you can explore the different types of skills you get from those work experience. So I definitely recommend, if that is a question you have, anyone watching, do explore those resources in a bit more detail.
I think that's a key thing, isn't it? It's sort of, it's very much harder to explain that passion without being able to say, and I think also to know whether medicine is right for you. Are there any things that you can think of that, because it's about how do you know that medicine is the right course for you if you haven't had that work experience? Can you sort of help explore any kind of other scenarios that you might be able to investigate in your own lives that would help you think, is medicine really right for me? Because I think it's one of those qualifications and degrees that everyone, a lot of people aspire to. Are they absolutely right for it? And without trying to make that decision without having had the work experience must be really difficult. So I don't know if you've got any insight into that.
It's a challenge. I think that you really need to understand that, as we briefly showed you on that week schedule, with some courses at university, your contact hours, I studied business studies and I think I was in roughly 10 hours a week. A medicine degree is a full-time course on Monday to Friday, placement opportunities on top of that. So thinking about that, are you prepared for that learning style? Also, I'd really, really recommend speaking to as many students as you can. Unibuddy is a wonderful platform for that. Lots of universities have that on their website, and you can speak directly to the students and ask them, how do you find studying alongside work learning? What is the challenging aspects of this? And then you can start to reflect on, do I still think this is the right course for me? And also looking at the modules of the course. I think a lot of people are always, perhaps from a young age, think that they want to do medicine, when actually they really have a much more scientific outlook, and that's what they're interested in. And in that case, something like biomedical sciences or our clinical pharmacology course, which, you still have some patient contact, but it's more science-based, that might be right for you. So not only look at the medicine course in detail, but also courses similar to it that you might be interested in.
I think that's excellent advice. I think it's, thinking about the time, the absolute monumental amount of how hard medicine, is for everybody who does it. And I have friends who've gone through medicine, and it's very demanding. And to also think, I think you touched upon this also in your presentation, is about communication skills. And, the whole focus on communication skills is obviously, I should imagine, I know, very difficult information sometimes to parents, to, patients, and to think, how would I feel about delivering, and also thinking about the communication skills you can then explore yourself to see, have I got, the right personality and communication skills to make a great doctor? So I think it kind of comes full circle in terms of where we started talking about, work experience, maybe working in a shop, with the general public. You don't know who's going to come in, just like you don't know who's going to come into a hospital, checking out your personal communication skills to see whether you want to deal with the general public in a very personal way. I don't know if you've got any thoughts about that.
I think before I came to work at St. George's, I never really, seemed silly, but considered how much patient contact you have as a doctor. And that is such a big part of the role. And, we, as a quick example, we start off by our students on the first year, we'll get them paired up to each other and say, okay, can you explain to this person that perhaps you just ran over their pet animal?
Exactly.
And that's a real challenge, right? And we then try to support them on that journey. As I said, we bring in actors to present as someone external that you do that with. And then by year 5, these students are amazing at delivering negative news in the best way possible. Yeah. And they're doing it on placement, and they're not even qualified yet, and they're delivering that to people coming into the hospital or wherever they're placed. A real challenge and something to really consider if you want to go into that career. This is something that you're going to have to do, but we do try to support you as best we can across that process.
No, I think, I just thought I'd mention that because I know it is something that's probably not talked about enough, but that communication of difficult information and those very advanced communication skills can be developed weirdly in, like I say, working in a shop. So, that can be a very good work experience, as well as, charity work and all the things that you've already mentioned. But dealing with the British public or the public generally is a good thing to do and can be done in lots of ways and is very valuable. But I think we've got a couple of questions that you've answered. So thanks to Malcolm, who's actually in the background here, also from St. George's, who's answered a couple of questions from Dollar Academy. And so I think we have to wrap it up now. We've almost out of time. So I'd just like to thank you so much, Jacob. It's been absolutely brilliant. It's been so helpful. I've learned lots. And I'd really like to thank you and to thank Malcolm, who's answered the questions in chat. Hope everybody enjoys the rest of the day. And please, can I ask you all to fill in this questionnaire? It's in the chat function.